Thank you very much, Sean, and thank you. It's wonderful to be here, and so many, are you still here? So I feel privileged to be speaking with you this afternoon. I wanted to set out my CNO strategy for my tenure here as Chief Nursing Officer for England. I wanted to set out my 3 priorities. And by far, my first priority, my most foremost priority, my most important priority is workforce. To address the missing nurses, midwives, and care workers. That has to be, it is our collective priority. So what are we going to do about it? What are we going to do about focusing our significant efforts to ensure that we do that? So I've got 5 or 6 areas that I want to focus on in particular around workforce. The first is to retain the staff that we've got, to retain you in this audience, to retain the people that are back at the ranch working, whether it's in a district nursing, whether it's in the community, in the acute, in the mental health, in the independent sector, no matter where they are, the first priority is to retain our staff. Now, I know that yesterday you had my deputy, Professor Mark Radford, from here talking in particular about, and in detail, about retention. So I don't want to go back over that. But you, in your organisations, are starting to make some significant improvements in keeping our workforce. So thank you. The second one for me has to be about recruiting more nurses. And I guess where my focus is going to be is about increasing the undergraduate supply. This must include, for me, supporting students in hospitals and community settings. And we had a target, we had an ambition that was set out in the long-term plan in January the 7th, my very first day as Chief Nursing Officer, that we would secure an additional 5,000 clinical placements. We haven't done that. We've busted it. We've got through to 7,000 clinical placements that have been pledged by providers across the whole of England. So thank you to the provider sector, thank you to the HCI sector that have really now stepped up and decided that this is going to be a priority, our collective priority about how we now making sure that we have sufficient clinical placement capacity for our new starters in September. Today, I have signed, in effect, a #TeamCNO check to the Director of Nursing at Calderdale and Huddersfield FT for £50,000. That is going to give her a direct transfer from me as Chief Nursing Officer to her as Chief Nurse, and making sure that they have sufficient funding to support their clinical placement capacity extensions. So I'm delighted by the way we started to do that. But it isn't just, of course, about the registered nurses. We have 14,500 healthcare assistant vacancies right now in England. And I am wanting us to prioritise how we, over the next few months, start to recruit in earnest to our healthcare assistant workforce. Because not only do they do an amazing job in whatever setting they do, in whatever setting they work in, but they're also a great area for us to recruit our future trainee nursing associates. So many of those healthcare support workers have had great education and support, and many of them want to go on to become nursing associates. So I want to now speak to my third area of my workforce priority, and that's about our leadership development. That's about how we see and value ourselves as leaders. And so there's a range of leadership challenges, leadership support offers, whether they're the newly qualified registered nurse, your general practice nurse, and even those then your head of midwifery, your executive directors of nursing. All of those leadership developments are really important. But every day we see the value of nursing midwifery leaders shaping decisions and operations across the NHS. So that's why today I'm delighted to make a special announcement that will play a vital part in ensuring nursing plays its future role as part of the digital and technology agenda. You will know that NHSX has been established, and it will be the largest digital health and social care transformation programme across the world. With the investment of more than £1 billion a year nationally and the significant additional spend locally, NHS has been created this week. So I am very excited to announce today that Matthew Gould, the Chief Executive of NHSX, and I are jointly appointing a Deputy Chief Nursing Officer for the clinical digital transformation. We both absolutely believe we need to dedicate and invest in clinical digital leadership from a Deputy Chief Nursing Officer level. I hope you will encourage those people, maybe in the audience, maybe back at home, wanting to apply for that role when it comes out in the next few weeks. The fourth area that I want to call out, and it was one of the people that I first met today, Roger Klein, which obviously is a big leader in race equality. So I want to call out our contribution, our leadership responsibility for all of us about ensuring that the RES priority becomes more than just the RES data, more than just the RES information, but absolutely becomes a reality so that we can all benefit from a diverse workforce and team. My fifth area is the unique gift of volunteering. I know that the NHS very much values volunteers, but volunteers can never replace a registered nurse, a midwife or healthcare assistant. But I also recognise that 1 in every 4 people in the UK regularly volunteers, and this represents enormous opportunity for us. We do have to do it right, with clear boundaries and training for volunteers. But I, for one, and my daughter Lucy as well, am also volunteering, and I'd urge you to do just the same. I know if I don't mention it, Sean will no doubt pick me up on it. So I wanted to talk about our workforce safeguards paper and document that we published last year in the autumn. It's really important that the boards of our organisations in the NHS in England have a collective approach to effective and safe staffing. We have been very clear that appropriate tools must be used, that professional judgment of nurses and midwives are listened to, and that we continuously monitor the outcomes this achieves. This policy makes it very clear what trusts must do, and importantly, if they can't fulfill that implementation, how to manage it. As CNO, I am very pleased that this is now in the NHS standard contract since this April. Being in the NHS contract since this April will ensure that services are commissioned with these principles used as a bedrock. So safety at the root of creating a new reality for nurses and patients. So ladies and gentlemen, that's workforce. There's a lot in there, and I could speak for about 5 hours. And indeed, I spoke for just over an hour at my first CNO summit just on workforce. I've only got 20 minutes, though, because that's all Sean's given me. But I wanted to give you a brief headlines about where my priorities are about workforce. So my second priority is about how we celebrate our profession, how we have pride in our profession, and how we use that to protect, enhance, and renew our reputation of nursing and midwifery profession. That pride for me last night was exhibited when I was with the nurses in North West Ambulance Services. That pride and passion this morning when I was meeting the senior nurses of the North West NHS organisations. And then at lunchtime, just before I was coming here, that pride and passion when I was seeing the practice nurses and community nurses in Manchester. So, that pride, that professionalism is something that we must be very, very proud about. We have the Year of the Nurse next year. The year 2020 is the Year of the Nurse globally. There will be lots going on to celebrate the work that you do all of the time. But we also need to start young. And earlier this year, just before my summit, I launched the Future Nurse gender-neutral uniform. My daughter Lucy was one of the first people, well, she was the first person to try that on, and indeed it's now going everywhere. Earlier this week, I was at St. Luke's School in London, and it was hugely encouraging to see a whole load of boys and girls experiencing what it was like to be a potential future nurse. So I'm building my vision as Chief Nursing Officer, a thought about leadership. Leadership is really important no matter what level we are, whatever role, our title, or areas of practice does not determine us as a leader, because every one of us is a leader. And shared leaders have a huge benefit. It ensures that care that we deliver is of the highest caliber and is safe. And the reality of shared leadership also enables a leadership mindset that ultimately focuses on pride that all nurses and midwives should have in their profession. So today I am delighted to announce that I am formally supporting the first national cohort of trusts to progress through the Global Pathway of Excellence programme. The programme offers staff collective ownership to develop and improve practice, influence national, regional and local policy, shape professional strategy, placing them at the centre of the decision-making process. The programme is built around 6 standards: shared decision-making, leadership, safety, quality, well-being and professional development. Many of you will know and have seen all over the press the great work of Northampton General Hospital, who I want to congratulate on being the first UK trust to be awarded the formal Pathway to Excellence accreditation. The embedding of these 6 pathway standards across the organisation has resulted in fantastic outcomes, whether it's reduced nursing vacancy rates, reduced pressure ulcer rates, rates of C. difficile, nursing complaints, patient survey response, staff engagement. Northampton General Hospital colleagues will tell you it was worth it. Their hard work was worth it, and I congratulate them on achieving it. So today I am announcing that we are going to support 14 trusts across England over the next 2 years with a £1.6 million worth investment so that we can support them to join this highly respected international programme of nursing excellence. So my third priority as Chief Nursing Officer has to be about speaking with a collective, powerful voice. Nurses and midwives haven't necessarily always been at the table, and even when we have been at the table, we haven't always necessarily spoke with a collective voice. That is changing. You and us are changing that right now. And I'm delighted that we will do that. And we have the opportunity, of course, of a new Prime Minister. We have the opportunity of the forthcoming spending review to make sure we use our shared collective voice in that. So, ladies and gentlemen, those are my 3 priorities. By far, my biggest priority is workforce. Second is how we harness and celebrate the pride in our profession. And third is how we come together with a united and shared collective voice. It's a very ambitious agenda. It's absolutely consistent with the long-term plan and indeed with the interim people plan. But it is what we need. It is what we need right now, in the medium term and in the long term, that we concentrate on filling the missing nurses, midwives and care workers. And ladies and gentlemen, I hope you will join me in helping to deliver that reality for us all. Thank you.
Thank you very much for that, Ruth. And I have to say, I've been waiting long time for a chief nurse to stand in front of an audience like this and say she's going to celebrate the profession and talk about the standards of nursing education, etc. I've been waiting for that, and I think let's start on that point, because it's always fascinating to me as a non-nurse, someone who isn't a clinician at all, to see sometimes how nursing debates still whether this should be a degree-educated profession. And there are questions on Slido about bringing back the diploma, etc. And I just wanted to ask you, as chief nurse, settle the debate for us once and for all. Finish this off. Why is this a persistent issue, do you think?
Many of you would have seen that I've been quite active on Twitter recently, whether it's arguing with a counsellor or arguing with the Guinness Book of Records or arguing about all sorts of things. But I feel passionately, and while I am Chief Nursing Officer for England, the graduate nurse is the role that I will back completely. We fought hard to be a graduate profession. I am proud that we are a graduate profession, and while I am CNO, we will continue to have a graduate profession, and that is why we are concentrating very heavily on increasing clinical placements so that we can increase the undergraduate supply. And I hope the undergraduate supply for this September. That I may need your help on.
And I think we can already see your influence in the system at the moment, because Simon Stevens has recently said, in fact, he was at your CNO summit, that there is no substitute for a registered nurse, which was wonderful to hear from the Chief Executive of NHS England. So you're obviously twisting all the right.
And he also went and said he's got his personal support for the reintroduction of continuing professional development. So absolutely, I'm very pleased that Simon is being very vocal about his support for nursing. It is no accident that we have in the interim people plan as the third priority, the investment and the focus on nursing. It's not nursing and this and that and this and that. I'm not saying that it's not important to continue our investment in midwifery. It's absolutely important to continue our investment in all sorts of areas, but nursing is a priority, and I'm delighted to have his support for that.
And just sticking with celebrating the profession, away from what nurses may think of each other, I think there is an issue around the public's perception of nursing, and you'll know that I've engaged in my own Twitter game sometimes around this, and the way that nursing is talked about and portrayed. And what do you intend to do as chief nurse around the public's perception of nursing and changing that from the handmaiden of the surgeon to the educated clinical professionals we know that they are?
Well, we all have a role in that. It's not just down to me to have that role. And I think Jessica, the sister in Bart's Health that did the marathon recently, did a lot herself to change the perception of our profession. There was a Twitter storm. There's a number of people in front here. I can see Alison and colleagues here that we were all on Twitter that weekend. And it was only Monday morning we got Guinness Book of Records to change that. But we have a perception. If you only got to go into Amazon and look for children's nurses uniform, you come up with a little girl, always a girl in a dress with a cape and a hat and a cross. There's a lot of work we need to do around changing perception. So yes, we've talked about mini uniforms with the youngsters, but we going into schools and changing that around. It's something that boys and girls can go into. But we have the Year of the Nurse next year, which I think is a huge opportunity to really not just celebrate, but to reinforce what we do, celebrate our past, celebrate everything that many of our very brilliant senior nursing leaders in the past have done, but actually look to the present and the future. And I think we've got all of us, and I'm looking forward to the Year of the Nurse, to us being able to really address that. Any ideas on a postcard around the Year of the Nurse about what you'd like to do, what you'd not like to do, then please use the DM me and keep in touch.
I think everyone in the room will be waiting for me to ask a question about safe staffing. And you very rightly said workforce is your top priority, and that NHSI has produced the workforce safeguards, which are now in the standard contract. But you and I both know that the NHS has got a huge number of vacancies for nursing. This has been a problem a decade or more in the making, and ignored for too long. And there's a question on Slido around how will trusts afford the nurses they need to meet safe staffing requirements. And there is still a tension there, isn't there, between the safe staffing requirements and needs of a ward versus the money that's in the system. And how can people in the room who have to deal with this balance that equation?
So safe staffing is for all care sectors, whether that's an independent sector, a general practice, or an acute ward or a community. Safe staffing for me covers the whole spectrum. I'm not going to sit here and lie to you that we have enough nurses. We don't, or midwives or care workers. You know, we have 40,000 vacancies in the acute and in the provider sector. I'm not going to say we don't. What we also know, though, is that we are spending in excess of what it would cost to recruit a nurse on agency and locum shifts. So the cost balance is there for me. I think there's an argument that we can make. The biggest issue for me is, have we got enough nurses in the system that we can attract and retain? And that is why I put my first two priorities as part of my workforce, has retain the people we've got, and we have to recruit and get those undergraduate supplies. I haven't got a magic bullet. I haven't got a knitting machine to produce more nurses right now. What I do have, and what we all have, is a collective ask and ambition to keep the ones we've got and attract more into our profession.
And just sticking with the safe staffing theme, one of the interesting developments, I think, under your leadership at NHS Improvement has been the centre taking a little bit more of a grip about this and being a bit more directive to trusts about what you expect them to be doing and seeing. And I know the safeguards have within them some level of regulatory powers for you to actually intervene and just tell the audience a little bit about that, because I think that's quite a fresh development that we've not seen before.
So going back in time when I first launched the 10 points of safe staffing, yonks ago now, 2012-13, Alison will correct me, or Elaine will correct me, about that time, we talked about it being a board's responsibility, not just the Director of Nursing responsibility. We talked about wanting those decisions to be made in public, not delegated down to some subcommittee, to another subcommittee, to another subcommittee. There is a whole range of those things. The safeguard document makes it much more robust. It gives us the regulatory levers, but it also making sure that we're pointing out to boards, to non-executives, their whole responsibility around safe staffing. It is absolutely the responsibility of making sure that the Director of Nursing leads that, but it is not only the Director of Nursing's job to make sure there is safe staffing. So we've been asked to do that, and we're asking trusts to take those discussion points to their public board meetings, and they should have done that in the first 3 months of this year. We'll soon see whether all trusts have done that.
Interesting. And for the most popular question that's coming in on Slido is about how can we improve recruitment without the bursary system for students? It's their question, not mine.
I wonder who's asked that. I don't know what to say. I do know what to say. I think I genuinely believe that we need to attract people into our profession. Yes, the financial incentive is part of it, but also how we promote our profession is part of it. I am absolutely influencing, and I am working as part of the people plan to consider how we support students in the future.
Okay, and let's do a quick questions if we can. There's a question here about until wages go up, working conditions improve, and HCAs are properly supported rather than being left on their own, the chance of recruitment is slim. So in effect, that's a question about wages and pay for nursing staff. That is a big issue, isn't it?
Well, we've had the agenda for change pay. I'm not going to be able to go into whether they're going to reopen that or not, because we've already had the agenda for change pay deal that was done 18 months or so ago. I do know, though, that those organisations that do invest in induction programmes, support programme and training for HCAs, they do end up retaining them more. So I was at a nursing home in Kings Lynn, a fantastic nursing home there. Those HCAs were all telling me, even without the manager present, all the training that they're doing, and they're wanting to go on to do other training. So there are many examples, whether it's across the NHS or beyond, that where people are investing in training, where people are investing in clinical supervision, then people are wanting to stay.
There's a question here around communicating the problem of chronic resource shortages to the government that clearly doesn't have the NHS as a priority. Now, I'm not going to ask you to necessarily comment on that one too much, but except to say that I think you have a different role to the previous CNO in terms of access to the government, and then perhaps that might give us some insight into what you're doing for this kind of issue in communicating with the government.
Yes, so I have a role as the Executive Board Member at NHS England and Improvement under the leadership of Simon Stevens, but I also have a role to be the professional advisor for nursing to the Secretary of State, which of course is Matt Hancock at the moment. And that is an interesting role. It is one that requires directness, and at my CNO summit he said, and Ruth can be very direct. Maybe I've been a bit too direct, but it is one that I value, having a direct conversation with him and his officials, and having that three-way conversation with NHS commissioning, NHS provider organisation, and with the health and social care. It gives me the opportunity to be able to say what I believe ought to happen for our profession. And believe me, I do.
Well, Ruth, you've set out your vision and you're already writing cheques for trusts. So I think all of us here wish you the best of luck with your vision and hope that you can deliver it. Ruth May, the Chief Nursing Officer for England, everybody.